Hey folks, welcome to the weekly COVID review. As usual, I have lots of news to cover. Welcome to the weekly COVID review. Sorry about that. A little feedback from my Facebook feed. So as usual, lots of news to cover. By no means is this pandemic over. In fact, globally, there's some really concerning numbers coming up, particularly with the new variant, the Delta variant. So today I want to talk about, of course, the global, national, local numbers, as well as a little bit more about Delta and how that's going to affect the future of this pandemic, both globally and locally. I also want to talk a little bit about breakthrough infections. The Utah Department of Health recently released some really interesting data on breakthrough infections within the state of Utah. So we'll take a little bit of a dive into that. And then finally, discuss the news surrounding the CureVax vaccine, which wasn't really great news. And then also talk a little bit about the Novavax vaccine, which actually, quite honestly, I think the media has not hyped enough. I think this could be a really important tool for the future of this pandemic. So we'll get started today. So as usual, if you're on Facebook, you'd like the Zoom link, please DM me. I'll get that to you. Otherwise, this will be on Facebook Live, and then I will upload the video onto my YouTube channel so that if you need to watch it later on, you can. All right. So if you have any questions, please feel free to put it up in the chat on Zoom or put it up on comments in Facebook Live. So as I mentioned, we are by no means through this. In fact, the numbers are showing a disturbing trend of flattening out. So we are again entering a plateau at a fairly high level. So if you can see, our levels are about equal to that of February early this year. So it looks like we've passed this little peak, but numbers are starting to plateau, perhaps even rise again. That most of that previous peak was due to the numbers in India. That numbers in India looking much better now, but there are other regions where there are surges, so that's what's creating this plateau now. So we're now at 179 million cases, at about 370,000 cases a day. It is a little bit of a decline since 2 weeks ago, but again, it's showing looks like a trend of flattening out. As far as where the numbers are high right now, of course, South America remains a huge hotspot, as well as Russia, India, Indonesia, and the southern part of Africa. The US, of course, is still, we're still at a fairly high level, but things aren't looking terrible in the US so far. Look at the details, you can see that South America, this is from a count standpoint, not counts per capita. From a count standpoint, is the continent with the highest number of daily new cases. South America is having about 140, 150,000 new cases a day, which is now exceeds that of Asia. So things are still looking grim in South America, with, quite honestly, it seems like there's no end in sight. We'll talk about that a little bit. Europe is seeing a little bit of an increase after several months of declines. It looks like European numbers are now kind of inching up. You can see that it's taking a little bit of a turn. North American numbers are plateauing, and this is ominous. Africa is now seeing more daily cases than North America. So Africa, and I've been talking about this, we all talk about this, how this disease could be devastating in Africa, sub-Saharan Africa, if it's not controlled. And it seems like we're entering those stages. I threw in Oceania here because I haven't thrown in Oceania because it hasn't been an issue, but there has been an outbreak in Sydney. We'll talk about that in a little bit, and that's a little bit of a concern as well. So overall, there's some ominous signs right now globally in terms of the direction that COVID is taking. Looking specifically at countries, these are top 25 countries in cases per day, 7-day rolling average. You can see that Brazil is now number one at 77,000 cases a day. That's a lot. That's quite a bit. And India continues to do better now. They're now second at 55,000 cases a day. Third is Colombia. Fourth is Argentina. Russia is now fifth. South Africa has now exceeded the US in terms of number of cases per day. So again, this is really ominous signs for sub-Saharan Africa, particularly the southern part of the country. But it's starting to spread up north. Uganda is having some issues. Tunisia is having issues. So we'll get to that in a little bit. UK is now close behind. So UK is seeing a bit of a surge, and it's kind of leading the way in this with the European surge in cases, driven, of course, by Delta. We'll talk about that in a bit. Iran, Philippines, there are some, Southeast Asia continues to have some ups and downs. You can see that there are a few other African countries. Zambia is in the top 25. Tunisia is in the top 25. Mongolia continues to struggle. And Thailand continues to struggle as well. As far as per capita numbers, this is completely dominated by South America along with Mongolia. You can see some really hot spots. Uruguay and Colombia in particular, Brazil and Argentina still have high numbers. And of course, joined by some really high and disturbing numbers in the southern part of Africa. But you can see that it's starting to spread up towards the center and eastern part of Africa as well. I know Uganda is struggling a bit right now. And then there's also some hotspots in northern Africa. The Middle East continues to struggle as well. So, and then of course, South and Southeast Asia, there's some disturbing numbers in Indonesia and Malaysia, Thailand, and the Philippines. So globally, things are not doing great, quite honestly. In fact, I'm a little bit concerned with these numbers all over the world. It seems like Delta is definitely making its presence felt, particularly in countries with low vaccination numbers. And I'll throw in this other caveat. In countries with low vaccination numbers or high vaccination numbers, but with vaccines that are at low efficacy. Seems like those countries that have high vaccination numbers, but with the Chinese vaccines, are struggling mightily. So from a per capita standpoint, if you look at the continent, South America, 300 cases per million people per day. This is 6 times higher, essentially, than the next highest, which is Europe. Then North America, Asia, Africa, but you can see that Africa numbers are starting to catch up to Asia on a per capita level. And then Oceania is starting to show a little bit of an increase. That's that outbreak in Australia that they're very concerned about. We'll talk about that. In terms of individual countries, Mongolia is struggling right now. What's really concerning about Mongolia is that they have a really, really active vaccination campaign, and yet they're still seeing a huge surge. It's no surprise that the bulk of the vaccines being used in the Mongolian vaccination campaign are from Sinopharm. Again, a good vaccine, okay? 50% efficacy against the original wild type variant. That's the data we have. We don't know really much more beyond that. But with Delta, we don't know. We have no idea what the efficacy of the Chinese vaccines are against Delta. It's probably considerably less. And so it is surprising that countries that have high vaccination rates, but with low efficacy vaccines, are still experiencing serious surges. That includes, by the way, most of South America as well. Uruguay also has a very high vaccination rate. also with Chinese vaccines, and they're struggling. Colombia is third. Namibia is fourth. So again, really concerning given the lack of infrastructure in Africa. Africa did an extraordinary job of fighting off the initial waves of this pandemic, but you can only do so much for so long before those original tools that they used, isolation, quarantine, contact tracing, those become less effective over time. They are not viable long-term tools. Ideally, they're tools to use while vaccines are being developed, and then you implement vaccines, because you cannot expect people to isolate for X number of months, X number of years. And that's where we're at with Africa, as well as much of the rest of the world. So you can see, again, shocking that Uruguay, Colombia, Argentina, Brazil, Suriname, Chile, Paraguay, they're all, Bolivia, they're all on the top 25 list. Again, just to emphasize how bad it has been in South America. You also have some other countries, like I mentioned, Namibia, Tunisia, Zambia. So you have South Africa. So you have some sub-Saharan African countries, particularly from the southern part of the country, represented here, and then also Iran, Iraq. So there's a little bit of a flare-up in the Middle East as well. So some real hotspots now, and then of course the UK seeing some worrying signs. So you got the United Kingdom showing up in the top 25 on a per capita level. Okay. So here are the changes. You can see increases in Russia, a big part of the Middle East, parts of Europe, parts of South America. Now, South America has been at a plateau for the longest time, but again, a plateau at a very, very high level. So it might not be as stunning in this map. What I want to show you, though, is Sub-Saharan Africa. So you can see Mozambique, Zimbabwe, Lesotho, Botswana, all seeing increases, South Africa, and then also East Africa and Central Africa. That's, I believe, Niger, that's Chad and Nigeria, the Republic of the Congo, so Rwanda, Uganda, Kenya, all seeing some increases. Very concerning. And of course, Southeast Asia as well, Indonesia, and then Australia seeing an increase, as well as Myanmar. Now, Myanmar numbers are really highly unreliable right now, given that they're still going through a coup, and they've always been very secretive. So we're not really quite sure what's going on there. Good news, Japan and Taiwan seem to have gotten a handle on their surge, and things are looking better, which is good because Japan still insists on having the Olympics, even with the low levels of vaccination that they're experiencing. Striking, this is from The Guardian, US, a striking headline: silent decimation, South America is losing battle against COVID. I don't think South America makes the news anymore because they've been at such a high level for so long. They're not seeing surges, but again, they're not seeing significant surges, but they're just stuck at this really high level, daily rates and deaths per day. And so it's no longer news, but this has just been ongoing, and it's just been horrific, and there's honestly no end in sight. You have, and it's getting worse. The health system is becoming bankrupt. People are just getting sick and tired of isolating. The economic impact is incalculable right now in South America. It's probably setting back South America by decades economically. And again, without significant support, particularly vaccination with highly effective vaccines. That's what we're talking about. So we're talking about vaccines with efficacies in the 90%. This will just continue, unfortunately, because again, the traditional tools are no longer viable. You can't expect people to isolate this long. The economic impact is just is, to expect people to isolate for 6 months was, quite honestly, it's amazing that people did that. But we're now going on a year and a half. It's not a viable tool. You can't expect folks to do that. So really the only solution out of this is vaccination. Is to get highly effective vaccines. And unfortunately with the variants, that means more of the population has to be vaccinated. And it can't be with vaccines that have 50% efficacy. It's just, that'll slow things down, but it's still not going to stop these surges from happening. So again, we got to talk about this. I know a lot of epidemiologists don't want to talk about this because there might be biases against certain vaccines. Well, I think we can no longer hide the fact that these vaccines with 50% efficacy are not a viable tool, not against these highly transmissible variants. Okay, we need higher efficacy vaccines. All these countries, so you're talking about Uruguay, Chile, Mongolia. What's really striking about these countries that are UAE, Qatar, Kuwait, what's striking about all these countries with their surges is that they also have a significant proportion of their population vaccinated. I mean, we're talking about higher proportion of the population vaccinated than the US, but again, mostly with Chinese vaccines, again, mostly with low efficacy vaccines. Against the wild type virus, okay, that may be sufficient to control for outbreaks. However, with highly transmissible variants, remember, Delta is 60% more transmissible than Alpha, which itself was 60% more transmissible than the original wild type variant. It's just not enough. It's not enough. I mean, again, if you can vaccinate half the population of a country, 100%, the entire country with a 50% efficacy vaccine, only 50% of them are protected. It'll slow down a less transmissible disease, maybe even control a less transmissible disease. However, with the highly transmissible variant, it's just not enough. You still have 50% of the population that are viable hosts that can contract and spread the disease. That's plenty for a highly transmissible disease. This is why one of the most transmissible diseases, measles, R naught of 18, airborne. The estimated herd immunity level for measles is in excess of 90%. That means more than 90% of the population has to be vaccinated to control the virus. So the more transmissible the disease is, the higher the percentage of the population that has to be vaccinated to achieve control. So Delta is just really up the game. We need even more folks to be vaccinated. Again, and also if you're using a less effective vaccine, that also enters the equation. If you're using a less effective vaccine, that means even a higher level of vaccination has to occur within the population. And with really low efficacy vaccines, you may never achieve control, even if you can vaccinate 100% of the vaccine. Those are hard things to talk about, but we need to talk about that. Even the J&J vaccine, you could argue, is going to be less effective from this point on. Okay, by itself. Now, combined with mRNA vaccines, it might be a viable tool. So in the US, I think the J&J vaccine is still viable, especially because the advantages that it confers, particularly the one dose and the fact that it is a lot easier to store and distribute. But J&J vaccine by itself in a country, it's a vaccine that has probably against Delta, we're talking about below 60% efficacy. We don't know. We don't really have those numbers, but that's my estimate. So that's where we're at. So let's look at the individual regions a little bit closely. So this is some South America, you can see Uruguay's numbers are down now. So that's great news because they've been struggling for, I mean, since March. So you can see when they had that huge surge in March, things haven't really gotten better. And you're talking about a good 3-month surge. Now things look like it's getting better. However, Colombia's numbers are going up right now. I think that's largely driven by just pandemic fatigue. Folks who just cannot isolate any longer. They have to go out. They have to enter the workforce because it's either isolate or starvation. That combined with the political upheaval in Colombia, I think is causing this surge. Argentina's numbers are finally going down as well. That's good news. Brazil is just, they've been at this really high level it's for months now, and things aren't getting any better. Or, I mean, it's not getting worse, but it's not getting any better. Suriname's numbers are going down. Chile's numbers are finally going down. Paraguay's as well, and Bolivia had a little bit of a surge and things are going down. But overall, it seems like as a continent, South America is still struggling mightily. Now, East Asia, things are going pretty well with the exception of Mongolia. Mongolia is struggling. A lot of it is just plain old policy failures. For example, they had this huge vaccination campaign. And for a while, they were vaccinating huge numbers of people a day, but they didn't have basic infection control during these mass vaccination campaign. So those vaccination campaigns ended up being super spreader events. So just really bad mismanagement, miscommunication, inconsistent policies are driving Mongolia's surge. Now, again, I mean, it's getting harder and harder. Now, it says mismanagement and policy failures, but it is becoming more and more difficult. Our policy tools are shrinking. As the pandemic wears on, our policy tools diminish. They just, like I just keep mentioning this, but you can't expect isolation that's no longer a viable policy tool because people won't accept it. They just won't do it. Okay. These are no longer viable policy tools. The longer the pandemic goes on, the less tools we have, especially the ones that were effective early. You can't expect to use those again. So that's what's going on in Mongolia. And of course, the vaccination campaign is almost entirely made up of Chinese vaccines, which again have less efficacy. So you can see Mongolia's number compared to the rest of East Asia. Now, again, I mentioned Japan and Taiwan have done a good job controlling their numbers. They're on the decline. But again, I think the mistake that the East Asian countries made, and also Oceania, New Zealand and Australia, is that they got complacent with their numbers and they didn't have enough urgency to vaccinate. And in particularly Japan, I don't know what they were thinking. They were going to have the Olympics, but they had no urgency to vaccinate. I'm not quite sure if they thought that they were going to be able to control the vaccine strictly through travel restrictions and quarantines and isolations. Well, I think they learned the hard way that that's not going to happen. Eventually, you're going to have to vaccinate. So those countries are now vaccinating very quickly, but it might be too late for the Olympics. In my opinion, I think the Olympics are a horrible idea at this point. Southeast Asia, you can see that Indonesia is having a surge. Again, that's due to policy issues. For example, during the Hajj, Ramadan, families get together, everybody goes back to their home villages, a lot of movement. That's what's probably driving the surge in Indonesia. Thailand is an interesting case. That was just pure government corruption. They had lockdowns, but the lockdowns were only for the non-elite. Government officials were basically allowed to go to clubs and socialize, and the wealthy were also exempt from these laws. And that drove the Thai surges. Malaysia numbers are finally going down again. driven largely by family get-togethers, travel, during the religious holidays. Vietnam continues to do well, but even Vietnamese numbers are a little bit higher than they have been. So again, our policy tools are running out. Really what we're looking at is, vaccination. So it's incredibly important to get vaccinations out to the rest of the world. So yeah, the Indonesian surge. This is the worst surge that they've had. And again, mostly driven by considered policy failures. There are fewer and fewer tools that these governments have to utilize. So I can't say it's a policy failure per se. I don't think at this point we can blame individual governments for their policy failures. It is a global policy failure. And that failure is around the inability to distribute highly effective vaccines equitably to be able to control for these surges. So it's a global policy failure, not individual country failures. Again, you can't necessarily blame Indonesia or Mongolia for these surges. They've done an extraordinary job up to this point, but they're also at a point where these tools are no longer viable. Isolation, quarantine, travel restrictions, those are becoming less and less viable tools. South Asia is doing better. So you can see Sri Lanka, Nepal, India, all numbers have all declined considerably. Afghanistan, unfortunately, seeing a bit of a surge. Same with Bangladesh. Myanmar, again, those numbers are really sketchy, but seems like there's a little bit of a surge there. But again, the good news here is that India numbers seems to be down, as well as Nepal and Sri Lanka. But there are a few other countries that are seeing surges, probably again driven by the Muslim holidays over the spring. Same with East Asia, same with the Middle East. You're seeing surges in Oman and Kuwait. Oman is a country that did not vaccinate very quickly, and they are now, so it's largely driven by that. But again, a combination of religious holidays. And these countries, of course, have large guest worker populations, particularly from South Asia and Sub-Saharan Africa, probably what's driving their surges. Okay, again, even though they have high levels of vaccination, particularly Kuwait, United Arab Emirates, Qatar, those countries all have very high rates of vaccination. But again, they use a lot of the Chinese vaccines, which are not as effective. Israel's also seeing a little bit of a surge. Not huge numbers, but again, a concern given that they've been at a very low level for so long. Okay. Now, again, I haven't talked about Australia in a while, but they're seeing a little bit of a surge. Scariest phase of the pandemic, Delta variant spreading. Again, seems like some travelers infected with Delta got past their travel restrictions, and now you have a little bit of an outbreak in Sydney. I think they'll be able to control this, but again, travel restrictions, isolation will only work for so long. Got to vaccinate. So those are Australian numbers. Again, nothing to be hugely concerned about. In terms of numbers, you look at the x-axis. This is, we're looking, in the previous slides, we're looking at 800 per million, and you look at 1 per million or 1.5 per million. So not huge numbers, but still concerning. And just kind of tells you how Delta can spread, even with the tightest of controls. That's Africa. A lot of folks are really, really, really worried given the lack of infrastructure in Africa. Again, Africa's done an extraordinary job of controlling the numbers up to this point. But again, they're running out of tools. What they need right now is vaccines. And unfortunately, They don't have the vaccines. Only about 1.5% of the vaccines distributed have gone to Africa. That's a problem. That's an understatement. This is Uganda. They're running out of oxygen. We saw what happened in India. It's happening in parts of Africa. And quite honestly, countries like Uganda have even less oxygen to spare. And yeah, it is just, there are no vaccines there. Any vaccine they get through COVAX, they've used up. They need more. Right now, again, it's not as easy as people think. People think, oh, well, let's just send out the Moderna and Pfizer vaccines that we're not using, send it to Africa. The vaccine distribution issue is definitely a problem. It's a huge justice issue, huge equity issue, it's a huge scientific issue. It's a huge ethical just disaster. Okay, but at the same time, it's not as easy as just sending out excess Pfizer and Moderna vaccines to Africa. These are vaccines that are incredibly difficult to distribute. We have trouble distributing those vaccines in rural parts of the US because they're so sensitive. So it's not as easy as that. It's also not as easy as just sharing technology and basically sharing the patents. Again, the manufacturing processes for these vaccines is really, really new. It's really, really difficult to do. Even in middle-class countries, they're probably not going to have the manufacturing capacity to make these vaccines. Plus, long-term, if we start having, for example, Pfizer did not use any of the warp speed money to develop the vaccine. If we start basically sharing patents soon after they develop it, there's going to be zero incentive for private pharmaceutical companies to develop vaccines. Who's going to want to spend hundreds of millions of dollars developing drugs if they can't get a vaccine to protect their intellectual property? I'm not saying that this is a perfect situation. It's not. But it's also the system that we have. We are we have a global pharmaceutical industry that is free market, private sector. It's all we have right now. And it's a problem. I'll be the first to admit it. Those of you who've had me in class heard me rail about this. This is a problem for multiple reasons. But it's a system we have right now. So, it isn't as easy. Equitable vaccine distribution is not as easy as people think. It isn't just a matter of politicians say, fine, we'll just send out these vaccines, we'll share the pads, we'll share the technology. It's far more complex than that. It's going to take a lot of deep institutional change to how we develop vaccines, how we distribute vaccines. Okay. Here's Africa. So you can see Namibia's numbers, 500 per million. Not quite as high as, say, Seychelles, which hit 4,000, but still very concerning in a sub-Saharan country that just lacks the infrastructure, the healthcare infrastructure to deal with large-scale outbreaks. Botswana's numbers are increasing. South Africa's numbers are increasing. Tunisia, Zambia, Rwanda. So it's not just the southern part of the continent. It's starting to go up into the eastern part of the continent and the central part of the continent. So Zimbabwe, Uganda, Eswatini, Lesotho. So we're seeing some increasing numbers, and a lot of us are really quite fearful about how bad this will get in sub-Saharan Africa, particularly with the Delta variant. Russia's seeing a surge. Again, Delta, and a very slow vaccine drive. There's a huge amount of vaccine hesitancy in Russia. Russians just don't have a very high level of trust towards their public institutions. Guess why? And so even though they do have the Sputnik vaccine, the level of vaccination in Russia is very low, and it's just driving this current surge in Russia. We'll talk about the UK surge in a bit because I have some detailed data on that. But you can see Russia, Portugal seeing a surge, Sweden's seeing a little bit of an increase, just because Sweden is, wow. Yeah. So this is, and then this is North and Central America. You can see Costa Rica's numbers are down now, but Cuba's seeing a little bit of a surge. Dominican Republic is a bit plateaued. Guatemala is seeing a little bit of a surge. Mexico's seeing a bit of a surge. Mexican numbers are really, again, not really reliable. Canada numbers are looking good, however. They're now dipped below the US on a per capita level. The US is doing okay. But again, US numbers just seem to have flattened out at a higher level than we'd like to see, which is not entirely surprising given our low vaccination levels. So that's the situation globally with new cases. As far as deaths, we'll go through deaths really quickly. We're now close to 4 million deaths, double or triple, maybe quadruple that for the true death toll. We're now dipped down to about close to 8,000 deaths per day. So not as bad as it was, and we peaked at close to 15,000. So we're roughly half that number. And as we vaccinate, that's the one thing that vaccination will do. It should cut down on the number of deaths, especially if we vaccinate those who are at highest risk. One thing vaccines do extremely well, of course, is, again, prevent serious symptoms and deaths. So deaths is something that should see declines and shouldn't go up to as high as it has been in the past. The exception to that is Africa, given the low levels of vaccination in that continent. So I'm hoping that we don't see those horrific death numbers again. But we'll see. As far as the number of deaths, Brazil and India kind of dominate the list, with the rest of South America kind of falling close behind. If you look at the number of deaths, South America now leads the way. Asia, deaths are continuing to decline as the numbers decline in India. But South America, you can see that it's just staying at a very high level, right around 4,000 deaths per day in South America. So Europe, North America, and Africa, you can see that increase in Africa as well, which is really concerning. Brazil is now leading the way, about 2,000 deaths per day. Then India, but India is declining. Again, make sure you recognize that these are probably underestimates. Then Colombia, Argentina, Russia. The US is now 6th in deaths per day. So that's good news for the US. Indonesia is probably going to go past the US a little bit, probably in the next week or so. Peru, Mexico. So some real troublesome spots right now in terms of deaths. Deaths per million, this is almost completely dominated by South America, along with the southern part of Africa. So about 9 deaths per million, which is about 9 times higher than anywhere else in the world. Europe's probably next highest. So yeah, literally 9 times higher the deaths, 8 to 9 times higher than the rest of the world. So South America is struggling, and there's just no end to, it's a decimation is not, so decimation is defined as 1 in 10, right? Deck. So 1 in 10 deaths. Will we see that in South America? Reduction of population of 10%. I don't know if we'll get to that much, but it's just something that we've lost. I think people have just kind of forgotten about, but it is just it's just been devastating in South America, and it just continues on. So you can see Paraguay, Suriname, Colombia, Argentina, Uruguay, Brazil. So the top 6 countries are all South American in terms of deaths per million. Okay, then you have Botswana, Namibia, then you have the southern part of Africa, Tunisia, then Peru, Oman. So, Peru, Chile, Bolivia. So again, just emphasizing how bad things are in South America. You can see these African countries kind of showing up in this list as well. So here are the changes. You can see increases in deaths in the UK, Norway, Sweden, Indonesia, Papua New Guinea, the southern part of Africa, a few African countries like I think that is Ghana right there, Uganda. So, and then Southeast Asia as well. All right, so that's deaths. Again, I'm hoping in countries with high levels of vaccination, even the Chinese vaccines, we should start seeing declines in deaths. Okay, even less effective vaccines are more effective, are still pretty effective against hospitalizations and deaths. But again, that's assuming there's even some level of vaccination. In sub-Saharan Africa, there's almost zero vaccination. 1.5%, they've received 1.5% of all the doses administered so far. It's a fiasco. As far as doses administered, we're up to about 3 billion. Again, 1.5% of that to Africa. We're about 35 doses per 100 people. These are primarily 2-dose vaccines. We have a long ways to go. Here are the countries that lead the way in terms of 1 dose. So this is share of the entire population. Iceland has done an extraordinarily good job. 1 dose. Then Kuwait, Canada. Canada's really ramped up their vaccination campaign. Now, we'll talk about Canada's campaign a little bit. Their strategy, it is leaving them at risk for surges, unfortunately. Even if with 67% of the population 1 dose, they're still susceptible to surges because their 2-dose numbers are much different than their 1-dose numbers because of their strategy of vaccinating as many people as possible with 1 dose. Then the UK, Chile, Israel, Bhutan, Uruguay, Mongolia, Qatar, Finland, Hungary. What's really, really sad is the US is now this far behind in vaccination now. We're now behind Italy. The Western European countries are quickly catching up and surpassing the US. And they'll probably all surpass the US in a little bit. As far as fully vaccinated, Israel leads the way, 60%. Now, Israel's numbers have been stuck at about 60% for a while now. And a lot of people wondered about that. And that's because they've pretty much vaccinated all the people that they can. The remaining folks that are left to be vaccinated, which is about 40% of the population, are either under the age of 12. And Israel, I was looking at their population distribution. About 26% of the population is under the age of 12. It's a fairly young population. I didn't realize that. So, those folks, they cannot get vaccinated yet because it hasn't been approved. Israel's still trying to catch up with their 12 to 15 population. They just started that vaccination campaign just a month ago, so they're still catching up there. The remaining 10 to 15% are those who are hesitant. So, they're about maxed out as far as, the people that they can vaccinate. Okay. And, 10 to 15% hesitant, it's not terrible by global standards. So that's where Israel's at. So the question is 60% enough to protect against surges? Against the original wild type variant or alpha? Maybe. Delta? Maybe not. The surge in Israel, again, travelers entering the country, breaking quarantine rules and spreading the disease. So Israel has now re-implemented a masking mandate for indoors, and they've actually strengthened the enforcement of their travel restrictions, particularly the quarantine. Mongolia, second, Chile. So Chile, again, 50% of the population has 2 doses, but the vast majority is using the Chinese vaccines. So only about half of those people have full efficacy. Half to 60% of those folks are actually protected. Okay, that's why you still have lots of breakthrough infections and surges in countries like Chile. Same with, we'll talk about the UK in a bit. And then you can see the US is about 45%. We're in the top 10, at least here. And then you can see the rest of the list. Western Europe Europe in general is really starting to catch up. So that's good news. As far as doses administered per 100 people per day, Iceland's leading the way. They're really, really vaccinated. 3% of their population per day. So they're vaccinating like crazy. And I believe Iceland is using AstraZeneca, Pfizer, Moderna. So relatively high efficacy vaccines. China is also really ramping up their vaccination campaign. Germany, Canada is still vaccinating like crazy. The US isn't even on this list. We're at like 0.3 per day, per 100 per day. So we're not even on this list anymore. Our pace has really, really slacked off considerably. And so I just put this out to point out the vast differences that some countries have between share fully vaccinated versus share of one dose. You look at Canada, again, they took the strategy of vaccinating as many people with one dose as possible before worrying about the second dose. Serena has relatives in Canada, and some of her relatives had to wait 2-3 months for the second dose because they weren't prioritizing second dose. Now, against the original variant as well as the Alpha variant, that might have been an effective strategy. Against Delta, it may not be. The preliminary data coming out of the UK show that one dose of Pfizer is only about 20 to 30% effective against Delta. Against Alpha and the original variant, it was about 50 to 60% effective with one dose. So one dose vaccination still leaves you very, very much exposed to the Delta variant and to surges with the Delta variant. So we need to really emphasize 2-dose regimens. There's still a lot of folks have asked me, so what does that mean about Johnson & Johnson? It's a 1-dose vaccine. It's less than 70%. The data on that is less than 70% effective, which again, in the US against the original variant, and when the vast majority of people vaccinated in the US is the 2-dose mRNAs, that might have been okay. Against Delta, right now, we just don't have enough data on it because we just don't have enough people vaccinated with Johnson & Johnson to really kind of look at that data. My guess is that with Johnson & Johnson, we're looking at possibly less than 50% of effectiveness against Delta, maybe even lower. It's hard to say. So it's something that we need to consider. Maybe folks with Johnson & Johnson are going to need a booster sooner rather than later. Right now, we just don't have that data. So as far as shares of folks fully vaccinated, this is the depressing news. You can see Sub-Saharan Africa have seen very few people vaccinated. Even first-line healthcare workers are still waiting for their vaccines in Africa. It's an absolute fiasco. We really need to rethink that global vaccination campaign. It is not we have to have a global strategy. We really do. And a global entity that can enforce the global strategy. I mean, from an ethical and scientific standpoint, it is an utter disaster. If we could have used these wonderful 95% effective vaccines using science and justice and vaccinating the greatest risk around the world, we might not be seeing the numbers we are today. So it's not just an ethical and a social and a justice issue, it is a scientific issue. So Asia is starting to dominate as far as the number of vaccines being administered. That's largely driven by India and China. And so that makes sense. But again, Africa continues to lag behind. You can see that that's right about maybe 2-3%. And then if you look at income, lower middle income and low income, so it's not even showing up on this list. So let's talk about the UK. And some data came out of the UK. So the UK has done a great job of both monitoring, typing their strains for variants, as well as ongoing studies on just ongoing surveys of prevalence by variant, by vaccination status, and so on. And so we can glean a lot from this UK surge. So you can see the surge is not insignificant. Okay, so it's a fairly significant surge. Now, what's concerning with a lot of folks is that UK has a fairly high level of vaccination. Okay, they kind of, like Canada, they followed the strategy of prioritizing one dose, and the second dose for some folks didn't come for several months after the first dose. But their second dose have caught up. So what's driving this surge? I mean, we're talking about, if you go back to UK numbers, you're talking about roughly 64% of the country with one dose and close to 50% with two doses. Well, a few things. About half the country have been vaccinated with the Oxford AstraZeneca vaccine. That one is less effective than the mRNA vaccines. We're looking at probably 75% efficacy. Against Delta, it's probably even less effective. So keep that in mind. Okay, we do know that 2 doses of the mRNA vaccines are highly effective, still close to 85 to 90% effective against Delta. Okay, but the AstraZeneca is not going to be. So keep that in mind. Okay, not everyone in the UK was vaccinated with Pfizer or Moderna. A lot of folks had a less effective vaccine. Okay, so again, you can see that the share of tests that are positive has also gone up. Hospitalizations have gone up a little bit. It will not go up as high as this winter. I will almost guarantee it. Why? Because of the age group that this surge is really affected. And that's the younger folks who are less susceptible to hospitalization. Same with deaths. We will not see the level of deaths that we saw earlier because this surge is affecting younger people. So let's take a closer look at who this is affecting in the UK. So the UK has done what's called REACT-1. So this is a survey that they're on round 12. This is a broad prevalence-based survey of cases in the UK. They look at age, they look at basic demographics, region, but they also look at variant and whether folks are vaccinated or not. So they just published the most recent version, round 12. This is not yet peer-reviewed. It is pre-publication, but I have no reason to think that this won't be published soon. What they found was, and this is the abstract if you wanted to read over it a little bit, basically, point 1 is that the vast majority of this surge is the Delta variant. Up to 90% of all of the new cases during the surge is Delta. Number 2, the vast majority of the folks who are contracting Delta during this surge are unvaccinated and younger folks. Usually that Venn diagram is it's a fairly broad overlap. It is much less of a problem for those vaccinated and those who are older. So that's really, really great news. And I'll show you the details for a second. So you can see round 11, which was done around April to May. So before the Delta variant became established in the UK, you can see, Delta was much less. 93% of the cases in round 11 was Alpha. Round 12, 80% are Delta. So this is being driven by Delta. So you can see, yeah, this is, mid-June, about 90%, more than 90% of the cases are Delta. That makes sense. When you have a variant that is 60% more transmissible, it will become the predominant variant. It's going to outcompete all the other variants. Okay, it's going to literally outbreed the rest of the variants. It will become the predominant. This is what's going to happen in the US as well. Okay, it is already happening in the US. I'll show you the data on that in a bit. So this is from round 11. Now, this is really kind of hard to read. There's a lot of data here. I have a nice little graph that summarizes this. But suffice to say, this is round 11. This is round 12. And notice this is broken down. What I want to focus on is age. The prevalence, okay, the weighted prevalence in the 5 to 12 was 0.16 in round 11. It's 0.35 in round 12. So this new surge is primarily affecting younger unvaccinated folks. Remember, under 12 are not vaccinated because there's no available vaccine for them. They're bearing the brunt of this surge, as well as other populations. Like, for example, under 25 to 34, 0.21 in round 11, 25 to 34. No, I meant 18 to 24. It's 18 to 24, 0.10. And then 18 to 24 in round 12, 0.35, 0.36. So this is a group that is eligible to be vaccinated, but are not vaccinating at very high levels because they're younger population. There's a perception that it's not as serious. There's not as much urgency. They're the ones that are bearing the brunt of this. So you can see round 11, 5 to 49, 0.13. Round 12, 0.20. And you can see in the 50 and over, there's not much of a difference in the prevalence of COVID. So Delta is primarily affecting younger population. And here's a nice little illustration here. Round 11, round 12. Again, round 11 is primarily Alpha variant. Round 12 is primarily Delta variant. You can see huge increases in the 5 to 12, 13 to 17, huge increase in 18 to 24, decline in 25 to 34, and the rest of those groups within the margin of error. Not much of a difference in older populations that are more likely to be vaccinated. This is primarily a surge for the young folks. And then this breaks it down by vaccination. So this is under 65. So you can see the prevalence percentage positive in the unvaccinated is about 0.23. Vaccinated 2 doses, 0.07. Okay, and in over 65 unvaccinated, well, there's really nothing going on in the over 65. Again, there's so few cases here that the numbers are really unstable. But this is what the primary takeaway here is: either unknown vaccination or unvaccinated. My guess is most of the unknown are probably unvaccinated. Huge differences between vaccinated and unvaccinated. The vaccines are still highly effective against Delta, particularly after 2 doses. After 1 dose, not so much. After 2 doses, highly, highly effective. The surges are among the unvaccinated. So you're still going to see surges because even though you have 60% of the population with at least 1 dose, 50% with 2 doses, because you have a much more, so that means you still have half the population that are susceptible hosts. Again, you have to have X number of people in a population susceptible to sustain a pathogen like COVID. Now, if it's less susceptible, you have 50% more, less, 50% of the population that's susceptible, less density of susceptible hosts. With a less susceptible variant, that might be fine. That might be enough to control it. but you have a much more transmissible variant, much more likely to transmit between person to person. So 50% may not be enough. 60% may not be enough. 70% might not be enough. That's what transmissibility does. It means that you, even with 60% of the population vaccinated, you're still going to have surges. Again, primarily in the unvaccinated. So if you're vaccinated, you are somewhat protected. But I'm going to throw out a huge caveat out. We still get breakthrough cases because the vaccines are not 100%. The chances of a breakthrough case increases the more virus is circulating among the unvaccinated. So the more you have unvaccinated transmission of virus, the more likely you're going to get breakthrough infections among vaccinated. So it's not enough for us to say, hey, I'm vaccinated, I'm safe. You're not vaccinated? No, that virus circulation in the unvaccinated is going to increase the risk for everyone. Unless we find a vaccine that's 100% effective, and that's not a thing, this is always going to be the case. But again, the good news is the mRNA vaccines, particularly Pfizer, still highly, highly effective against the Delta variant, and even more efficacy against hospitalizations and deaths. Deaths among the vaccinated, even with Delta variant, a very, very rare event. So that's really great news. We just need to get people vaccinated. So that we have a tool here. We just need to get people vaccinated. We just got to get past that hesitancy. This is Israel. So again, 125 patients diagnosed on Monday, which doesn't seem like a lot, but for Israel, given the numbers they were at, it is a lot. So they're reimposing mask mandates indoors and really kind of strengthening the restrictions on quarantine. They're really starting to crack down on people breaking quarantine as they enter the country. They're not shutting down travel. They're just making it, they're just kind of tightening up the restrictions around it. So here's Israel's numbers. I mean, again, compared to what they were seeing, it's not much. But again, you know, they're at a point where 125 is a huge concern. And they're being proactive. They really are. And by the way, they're also ramping up their campaign to vaccinate 12 to 15-year-olds. Okay. Let's take a look at US numbers. US numbers, they're declining, but not at the pace that they've been declining before. So we're kind of plateauing at a relatively high number. And there's some regional variations, obviously. But we're now at about 11,000, 12,000 cases per day, which is still high, which is really, really high. I would love to dip below 10,000 within the next week or so. We'll see if that happens. If we see a Delta surge, that won't happen, but we'll see. Deaths, though, the good news is the deaths continue to decline. We're about 300 deaths per day. Again, still high, but you know, the vaccines are really, really protecting against death. So, East Coast doing really great. There's some hotspots though. Missouri, Iowa, Arkansas, Texas, rural areas around there are seeing some little flare-ups. Western part of Colorado, eastern part of Utah, still some rural counties around Washington, Oregon, seeing a little bit of flare-ups. Okay. As far as new cases, Florida leads the way. Then Texas, it's not surprising. California's third. Missouri is fourth now. Notice Utah's in the top 10 in just numbers of cases. So Utah's not doing great. We'll talk about Utah numbers in a little bit. 2, 3, 4, 5, 6, 7, 8. Okay, top 12. Top 12. Can't count. All right. If we sort this by per capita, Utah's fourth. Missouri leads the way at 12 per 100,000 per day. Nevada 11, Wyoming 10, Utah 10, Arkansas 10. So Utah's not doing great right now on a per capita level. The other end of that, Vermont, Massachusetts, Maryland, DC, South Dakota, Tennessee, all doing quite well with less than one per 100,000. So really doing well. Vermont, Massachusetts, I'd be very surprised to see any surges from this point on in those states, given their high vaccination rates, very high vaccination rates. Vermont is now at 65% of the population fully vaccinated. That's of the entire population fully vaccinated. That's great. Massachusetts is close behind at 60%. Quite honestly, the New England states will be good places to be during surges because you won't see a surge there. My guess. In terms of states that have seen increases, Oklahoma's seen the biggest, a 63% increase in the last 2 weeks. Then Arkansas, Missouri, Alaska's seen an increase, Guam, Nevada, Arizona, and then Utah as well. So we've seen an 18% increase in cases. We've all seen that. The numbers have not been great as of late. I wonder if today's numbers are out. Let me check real quick. No, I don't think so. Okay. All right. Anyways, in terms of this is sort of by deaths per day. Florida leads the way, and then California, Texas, no surprise there. Michigan continues to decline. So after their horrific spike, things are getting better. And then from a per 100,000 standpoint, Delaware leads the way, and then Florida. Again, this is largely driven by age. What's concerning is Idaho has a fairly high mortality rate, which is really surprising. They don't have high numbers, but again, I mean, given the lack of vaccination in Idaho, that's not surprising. The states that are going to do the best here are the states that have high levels of vaccination, because again, vaccination protects against death. So that's really interesting that Idaho and Wyoming show up. Now, Idaho doesn't have a particularly older population either. It has actually one of the younger populations in the country, yet they have such a significantly higher death rate. Again, probably reflective of the lack of vaccinations in Idaho. Talk about national vaccination, or about 178.3 million people receive one dose. So that is about 54% of the entire population. This is entire population with at least one dose. That's out of 28. So, you know, we're looking at 178.3 million out of 280 million who are eligible. So we still have a long ways to go. And there's a huge amount of hesitancy in this country, which is really frustrating, given everything we know about Delta and how effective these vaccines are. So break that down by age group. So all ages, about 54%. But if we look at 12 and up, that's about 60%, 63% of 12 and up that have at least one dose, and 53% that are fully vaccinated. Then 18 and up, 66%. Now this is important, the 66%, because again, that's what we're trying to, our goal is again to get 70%. It does not look like we're going to meet that by July 4th. I mean, honestly, from a scientific standpoint, it's just a number. Doesn't really mean anything, but still, it was a nice goal to shoot for, and it looks like we're going to not meet it, unfortunately. Because why? Because look at the numbers of vaccinated per day. They've just plummeted in recent days. You know, we're now averaging 0.82 million doses per day. Not great. Not great at all. When, you know, at the peak, we were over 4 million doses a day. So we've really slowed down vaccinations. There's just no demand out there right now. People aren't getting vaccinated. And I think, you know, the low numbers and people going back to normal is just remove that urgency. I still think there's a lot of folks who would get vaccinated, but it's just not highly prioritized. And we've made it really difficult, you know. A lot of employers aren't giving time off, and they're not giving paid time off for side effects. We're not making it easy for folks. So that's also an issue. As far as states, again, Northeast, Upper Midwest, West Coast. And then there's a few outliers like New Mexico who've done really well. And of course, Hawaii's done really well. Southeast have done extraordinarily poorly, as well as Idaho and Wyoming. Same with fully vaccinated. If you look at county-wise, again, you see broad swaths of rural America that are not getting vaccinated. There's various reasons for that. Rural, urban is also associated with politics, whether you voted for Republican or Democrat. And that's strongly associated with vaccine hesitancy. So that's one factor. Another factor is, again, Pfizer, Moderna are really, really hard vaccines to distribute infrastructure-wise. Those rural counties just simply do not have the infrastructure. Our rural healthcare systems has been gutted. I mean, the last 20 years, we've been gutting rural health because there's just no profit in setting up hospitals in rural areas. So there's just a lack of public health resources, lack of places to go to get vaccinated. So combine all that, and you have rural areas that have very low vaccination rates, even among those over age 65. That's really hard to see. I apologize. But again, this is over 18. I think this is a fairer comparison. You can see that Utah is about middle of the pack. If you look at over 18. Again, that just shows that, age distribution does make a difference in looking at these numbers when you look at percentage of the entire population. So if you look at over 18, you can see that, wow, Vermont, 85% of those over 18 have at least one dose, and 75% fully vaccinated. So Vermont, Hawaii, Massachusetts, Connecticut, New Jersey, Maine, Rhode Island. So again, mostly northeastern states, throw in California. Yeah. And then look at the bottom here. Mississippi, Louisiana, Wyoming, Alabama, Tennessee, West Virginia, Arkansas, Idaho. Yeah, those states, we may never reach 50% of those populations vaccinated. My guess is we won't. There's that much hesitancy in those areas. And if we have a surge in Delta, let's just say when we have a surge in Delta, those are the states that are going to be impacted the greatest. Will we see surges in Vermont? Not of any appreciable magnitude. It'll be mostly in states like Mississippi, Louisiana, Wyoming. So as far as goals, those states up in the upper right-hand corner are states that have already achieved their goal of vaccinating 70% of the adult population with at least one dose by July 4th. Those states on the lower end, lower left-hand side, are those states that that's the projected date that they'll reach 70%. If at the pace that they're going right now. There's no guarantee that pace is even sustainable in these states. My guess is places like Mississippi, Louisiana, North Dakota, Wyoming will never reach 50%, never reach 70%, unfortunately. Unless something really, really bad, unless something dramatic happens. Utah's right here. We should reach 70% at the pace if we can sustain this pace by about September-ish, maybe. So again, in the face of Delta and surges through Delta, these are critical numbers. We're seeing what's happening in the UK, even with high levels of vaccination. We are still highly susceptible to surges with Delta. Even with the number of people vaccinated in this country, we're still highly susceptible. But it's going to be very, very regional. Like I said, if you live in California, upper Midwest, New England states, I think you'll be, there may be surges, but the magnitude isn't going to isn't going to be nearly as high as places like the Southeast, the Deep South, or Idaho. Okay. The good news is, even if we do see surges, we won't see the deaths that we saw earlier on because of our vaccination campaign, because those populations are largely vaccinated and they're going to be protected. What we will see is hospitalizations and deaths among younger populations. And then what's of course most tragic is that under 12, yes, we will see deaths. Yes, we will see hospitalizations. And this is a group that we should be protecting by vaccinating as many people who are eligible as possible. And we haven't been. These are folks who can't get vaccinated. Let's talk about Utah real quick. Some interesting numbers on breakthrough infections that we'll go over in a sec. Utah is, as you've probably noticed, numbers are going up a titch. Okay. We had a little bit of, we hit 500 again. Now, some of that 500 we saw, I believe, on Wednesday was due to a reporting error. And that was I think about 40 of them were due to a reporting error, but so it's still high. We're still seeing a surge right now. Increase in cases. Will we see an appreciable increase in deaths? Probably not. But we might, because again, we still have a high number of people who aren't vaccinated, particularly in rural areas. County-wise, we're looking at Salt Lake County with the greatest numbers, and then Utah, Davis. So again, we're looking at the Wasatch Front kind of leading the way. I think for Utah, it's more interesting to look at the per capita numbers. Per capita, Grant County still leads the way. They're still going through the surge. Then Kane County has a little bit of a surge. And then you can see that Utah County is a little bit further down, Salt Lake. If you look at the sorted by 14-day increases, Emory County, Sevier County, Summit County, all seeing a little bit of a surge. Salt Lake also a 30% increase in numbers. Utah County, 28% increase in numbers. Davis County, 26% increase in numbers. You got Weber County here as well. So yeah, bottom line, we're seeing a bit of a surge. Here's the details. So you can see, yeah, definitely seeing a peak here. We'll see how high this goes. If it's Delta, we might start seeing significant increases in the next few days. We'll see. I'm curious about today's numbers. I don't think I don't think they've published those yet, but I'll be curious as to today's numbers. Yeah, you can see that the test positivity has increased. That's a combination of less testing as well as more positive. So that's to be expected. Hospitalizations, you're seeing a little bit of an increase, but again, I don't anticipate huge spikes in hospitalizations and deaths because of because who's vaccinated and who this will be affected by. Here's my concern. B16172, that is Delta. And you can see that in the past few weeks, the vast majority of those variants that have been typed are Delta. And again, that's not unsurprising. Given how transmissible it is going to outcompete all the other variants. Delta is with us. And again, being more transmissible, it is going to go through the unvaccinated population much more effectively than Alpha did or the original variant. So even though we have a fair number of folks vaccinated, we're still going to be seeing surges. Again, it's going to be mostly in the unvaccinated, but it will increase the risk of breakthrough infections. Okay, so this shows you, again, you can see how just within weeks, how a much more transmissible variant quickly outpaces the less transmissible variant. That makes sense. You're talking about a vaccine that can reproduce that much faster, jump from host to host that much better. Of course it's going to outcompete. just basic evolution, right? Let's look at vaccinations. We've also slowed down. Now there's a little bit of a glitch in the data here as well. There was some vaccination testing errors that a bunch of vaccines that were counted as 2 doses, counted as the first dose, should have been a second dose. So that's been changed. That's why you don't see an increase. You're stuck at 60.1% of over 12 with at least 1 dose. But you saw a big increase in 2 doses, fully vaccinated, 51.4 to 52.9. That's because of that error. So I just wanted to point that out. Our vaccine rates are also slowing down, but we're not doing as badly as some numbers show. If you look at over 12 and over 18, we're about middle of the pack. We do better, of course, but we're about middle of the pack. What's interesting, though, is the variations in vaccination rates by region of the state. Huge rural-urban split. Rural areas are much less likely, much lower vaccination rates than urban areas. And even within counties, there's some really interesting variations. For example, East Bench versus West Side. East Bench has much higher vaccination rates than West Side. Okay. So here are the differences. Summit County, pretty high, all the way down to Piute County, which even above the age of 65, less than half the population is vaccinated. That is a concern. That is a huge concern. This is the most susceptible population. If you're going to see Delta, that's where you're going to see it hit. And that will result in higher levels of death. So we really need to refocus on vaccination. But it might be too late. I don't know. I'm hoping not. So vaccination rates, again, you can see that in the older populations, we're doing okay. It's this younger population, less than 50% of 19 to 29-year-olds are vaccinated, fully vaccinated. About half are just 1 dose. It only gets a little bit better for 30 to 39. 40 to 49, not that much better. 50 to 59, okay, we're getting better. But yeah, these folks have been eligible for vaccine for a long time. We need to get these folks vaccinated. They will drive, this is what's going to drive the surges. And in fact, let's look at the data. So Utah Department of Health is now publishing relatively detailed data on breakthrough infection. I wish they had more, but at least they're doing something. So kudos to Utah Department of Health for publishing this. You can see that the rates per 100,000 vaccinated for cases, hospitalization, death, and the percentage of fully vaccinated to get COVID-19. So it's about, if you are fully vaccinated, your risk of getting COVID is about 0.1. Not bad. The hospitalized is 0.01. And to die it's a really small number. Vaccinations are highly effective. Here are the rates by all Utahns, fully vaccinated, unvaccinated. So I did some calculations for the vaccine efficacy in the state of Utah is about 86% effective based on this. So the rate, I believe the rates, let me look at the numbers real quick. There we go. So the rate among vaccinated of COVID as of June 23rd is about 14.9 per 100,000. Okay. Among the unvaccinated, it's about 109.2. So about a 6 or 7-fold increase in risk if you're vaccinated, if you're unvaccinated. That relates to about an efficacy about 86%. Which is right on par with what we've been seeing with the data out of the UK and Israel. And remember, this is everyone vaccinated. So there are folks who are vaccinated with Johnson & Johnson, including in this analysis. And remember, Johnson & Johnson is less effective than Pfizer, Moderna. So that's about on par. So about 86% efficacy in the state of Utah. So vaccines are still highly effective, even against Delta. So that's the good news. But again, you're going to see increases in breakthrough infections as long as there is COVID circulating in the unvaccinated populations. But really good data here. I'm really happy that the Utah Department of Health is starting to publish this. So you can see the yellow or the orange, excuse me, is unvaccinated. Okay, the daily case counts by unvaccinated, and the green is fully vaccinated. So again, the more people, more virus is circulating in the unvaccinated, the more breakthrough infections are going to have. Deja, I wish I knew. I wish I knew.
If somebody has an idea, I don't know, because I had some 3 or 4 friends that they don't want it, and I don't know what to do.
I wish I knew. That's the biggest frustration right now.
Yeah.
We have the tools. We do. We have the tools to control this pandemic. We do, especially in the U.S. God knows we have the supply, we have the infrastructure. We just can't convince people to get vaccinated. So a couple of other news notes. Now, CureVac is a German mRNA design. It's a company that came out with an mRNA vaccine. Very disappointed final stage trial results. They reported about 50% efficacy of their new mRNA vaccine. So very disappointing, because this was a much cheaper and easier to store and distribute mRNA vaccine. And there were high hopes given the preliminary numbers. So lots of reasons why this may have been less effective. Number one, the dose is lower. So the CureVac dose is lower than Pfizer Moderna. There's just less mRNA particles in each dose. That could have made a difference. Number two, they did the testing with a bunch of variants. Pfizer Moderna, their timing was perfect. They tested during a surge, so they got data quickly, but it was a surge of probably the original variant and maybe Alpha. This one, there's a alphabet soup, Greek alphabet soup, of variants out there when they tested this. So perhaps this wasn't effective in Delta, and therefore they got the poor numbers. Number three, their mRNA design is a little bit different. They use a slightly different structure for their mRNA. And so there's thoughts that perhaps the immune system, now the immune system does react to foreign mRNA. So perhaps this design elicited more of an immune response to fight off the mRNA instead of having the mRNA actually produce the spike protein. So lots of reasons, but this was really disappointing. However, there is good news. I talked about Novavax, and we were kind of underplaying how important the Novavax vaccine results are, because in the US, supply is no longer an issue. We have plenty of vaccine, but the rest of the world, this could be a big, big player. Number one, Novavax, it's a brand new technology. This is not mRNA, this is a protein subunit. This technology has been around for decades now. We have other vaccines that utilize this process. HPV vaccine, certain flu vaccines use this protein subunit. It actually produces the spike protein outside of the body in the lab using moth cells, actually, which is a really fascinating process. But anyways, 90% effective. Okay, so new technology. By the way, the new technology is this is not new technology. It is old technology, I should say, but it's a new technology in terms of COVID vaccines. So maybe that could convince some folks to get this vaccine, saying it's proven, it's been used for all these other vaccines. So maybe this will reach a certain segment of the hesitant population. What's important about this, though, is that it is old technology. It is established. It is cheaper. It can be ramped up in very, very quickly in countries that don't have, the Pfizer can probably only be produced in the US and Europe, could not be produced in, say, sub-Saharan Africa. This one may be. Okay, the equipment to manufacture this is readily available. The technology is not that complex. Novavax is going to license the technology. They're not actually a manufacturer. They're a really small pharmaceutical company. They're not a huge manufacturer. Their plan is to license this technology to other manufacturers. So this can be quickly ramped up. It is cheaper. It is easier to store, easier to transport. Everybody can make this. And finally, the test for this was done when we had all the variants flying around. So the test for this, 30,000 across 119 sites in the US and Mexico, was done while in the presence of all these variants. So this efficacy is probably more accurate than even the Pfizer and Moderna efficacies that were published, because this was done in current conditions. This could be a really important tool in our fight going forward. We need this because we haven't had a new vaccine approved. I think there's been less urgency to develop new vaccines because Pfizer and Moderna kind of hit it out of the ballpark. Again, that was a great thing, but there were some drawbacks to that, in that it discouraged a lot of folks. Basically, they measured all their vaccines to Pfizer and Moderna, and if it didn't get any closer, it's like, we can't compete against that. We're going to stop production. We're going to stop development. And a lot of that happened, but this one could be a game changer. I've said that before, but this one could be a huge game changer, because God knows we desperately need more vaccine, especially a vaccine that is cheaper, easier to manufacture, and easier to store, but still have mRNA levels of efficacy. All right. I think that is all I had for today. So, summarize, not over, not by a long shot. Delta is something to keep an eye on, because it is kind of changing the game in terms of how many people do we have to have vaccinated in the population to control the virus. That level is now higher. We may have to vaccinate 70, 80% of the population to really appreciably control the spread of COVID. Good news is the vaccines are still highly effective, particularly mRNA vaccines. Okay, we just got to convince people to get vaccinated, at least in the US. The rest of the world, we've got to get these highly effective vaccines out. So hopefully the Novavax is one of those highly effective vaccines. So if you're vaccinated, yes, it's still safe for you. Has the risk increased a little bit? Yes. During surges, the chances of breakthrough infections increases. Luckily, those breakthrough infections rarely lead to hospitalizations and deaths. Most likely it'll be extremely mild if you have symptoms at all. So that's where we're at right now. Any questions? All right, good. I will log off for this week. I will again post this on, it'll be on Facebook Live, but I will post this on YouTube if you want to access parts of it. Again, thank you for participating, attending. I appreciate it. I will be back probably next week with more news on Delta. Let's see where the numbers in the UK go. Let's see how Utah does in this next week. Something to keep an eye on. See if this is sustainable, if this surge sustains itself. And yeah, let's see what happens in Israel as well. So that'll tell us a lot about the dynamics of Delta, right? But until next week, have a good weekend. Stay safe out there.
Thank you, Han.
You're welcome.